we'll have the presentations, feedback from the week-long event from the DG, who will be addressing us shortly, following which the floor will be open for your questions, and this will be attended to as usual. If we, the DG, sir, I think we may have to go on since the WR is still, or we should hold on a bit. All right, so the floor is now open for the press briefing officially, and the DG will be providing the feedback on this regard. Just a minute. The DG, sir, the press is waiting for your address. Thank you very much, sir.
All right. Well, good afternoon, gentlemen of the press. And thank you for your patience. It's a pleasure today to address you, accompanied by colleagues from One Health ministries and departments and agencies here, as well as the core team leaders of the JEE team, our IHR focal point, and we hopefully will be joined very soon by the WHO country representative. The reason for this press briefing is that, as you're aware, the country has just gone through its second joint external evaluation. This process started on Monday, and I'm referring to the external evaluation phase, started on Monday and concluded earlier today with a debriefing by the team of external evaluators and the reveal of our summary ready scores. As you may be aware, Nigeria had a JEE, the first JEE in 2017. The JEE is a voluntary evaluation process that stems from the International Health Regulations 2005, to which Nigeria is a signatory. And the International Health Regulations basically itemize or describe what countries' responsibilities are in the health security space, both in terms of assuring national health security and, of course, protecting the rest of the world. It provides a feedback in 3 or 4 domains that are grouped together under prevent, detect, respond, and then other IHR hazards. Feeding into these 4 domains are several technical areas that have been subjected to evaluations. In 2017, our ready score was 39%. For the domains of prevent, it was 40. For detect, it was 50. For response or respond, it was 33. And for other hazards, it was 37. And these were mostly red marked, showing that we were not ready, or indeed we were doing quite poorly in terms of our ability to both prevent, detect, and respond to public health threats. It is a pleasure to announce that at the end of the 2023 JEE, the ready score is now 54%. We have seen what appears to be a 10% increase in the domain for prevent, an 8% increase in the domain for detect, and an increase of 18% in the domain for response, and an even greater increase under other IHR hazards. I'm delighted as the DG of NCDC to see the progress that the country has made overall. This is not NCDC's progress. This is our national health security state of play. Health security is an all of government and all of population endeavor. It involves multiple agencies in the ministries of environment, ministries of agriculture and rural development, in the office of the National Security Advisor, in the Federal Ministry of Health, and in all of our subnational spaces. So significant progress has been made as an outcome of a lot of the investment that has gone into the health security space since the priority areas requiring intervention were identified following the 2017 JEE. Now, while we have now achieved the pass mark, as you know, this is not the end of story. It doesn't mean this is not the time to rest on our oars or become complacent. Beyond the score, it is important for us to focus on the gaps that were identified, the priority actions as recommended, the priority activities that will definitely come in the detailed report, and to use this to inform the next National Action Plan for Health Security, as well as other government priorities. I think this JEE has come at a real opportune time. We've had a transition in government. We now have new ministers that are going to be in office from Monday. We have a change in leadership across board, for example, in the Ministry of Health and in other MDAs. And this is the time that they now have sort of a prescription to use to inform immediate as well as short and long-term plans. We also know that the government, led by President Tinubu, also already has a health agenda which covers broadly a lot of overlapping areas that were identified as gaps. So universal health care, strengthening primary health care, and indeed universal health coverage are the foundation or building blocks for health systems and indeed health security as well. In addition, we have seen the report of the Health Sector Reform Committee that was produced by the immediate past government. So there are many ingredients now to which this is a perfect addition to inform all of the plans that we now need to make going forward to assure the health of Nigerians through investment in health security, to contribute to the building of a resilient health system, and overall to have great impact on the health and the well-being of fellow citizens that are served by all of the MDAs that are present. Just before I conclude, I would also like to use this opportunity to appreciate the high-level political commitment that has been shown by previous and current governments. Over time, there has been increasing or never before seen levels of investment in health security. Yes, we might say the investments need to be more, and this is because obviously there were major gaps before that these investments are trying to fill. And we are reassured by what we've had so far that the government continues to be interested in health security and will continue to walk the talk as far as the subject is concerned. We're also grateful for the support and the collaboration with partners, with the World Health Organization, both in the country, in the region, and from the headquarters. We are grateful to the WHO JE team in the headquarters who have sent the current team of observers to participate in this external evaluation, and we look forward to achieving even more impact through better synergy and better alignment of priorities and actions. So with those few remarks, I'll stop now, and we can take feedback or provide feedback on the questions that you may have. Thank you very much.
Thank you very much, the DG, for the remarks and the great overview. But before we go to the press, we want to yield the floor to the team lead for the WHO Joint External Evaluation, Team of External Evaluators, for your quick remarks on this exercise before we go to the press. Dr. Henk, the floor is yours, please.
Thank you very much. My name is Henk Ormel. I'm a senior advisor at WHO headquarters, and I had the privilege to visit your beautiful country. And I would like to start by thanking you for your hospitality. I really enjoyed Nigeria. I was here heading an international team of experts coming from all over the world, from the United States to Australia, from Gambia to Kenya to Zimbabwe. We were here a whole week to assess the health situation, the health security in Nigeria. And we had very frank and open discussions. The same was done 5 years ago, and Nigeria made a lot of progress. But you are not there yet, because a lot still needs to be done. And it is necessary for national health security that there will be more access for normal average Nigerians to basic health care. It is necessary that your food will be safer to eat. Too many of your children are still not vaccinated and die from preventable diseases. So a lot needs to be done. And what I can see, what we as external team were seeing, is that you are dedicated. The people who are working for you are professional and skilled, but they are understaffed. It is necessary that there will be more implementation of the plans that are made at the highest level to the local levels. You have to see that there will be more medical facilities, that there will be more medical staff, that your food will be safer. And by doing this, the government is not only helping you, but is also helping international health security. So there is improvement, but a lot still needs to be done. Thank you.
There's improvement, obviously, but still a lot to be done. Okay, so gentlemen of the press, the floor is now open, and we'll be glad to hear from us. We can have a roaming mic. So you can just signify by show of hands if you have any question or clarification. Please do well to introduce yourself and the organization or media house you represent. Is someone helping with the mic? Thank you.
Thank you so very much. My name is Rachel Abuja, and I report for the News Agency of Nigeria. My first question, what's his name again? WHO lead, team lead, is for you. What will you say is the key takeaway from this second evaluation that Nigerian can take to the next level? That's for you. And these are for the MBAs. I don't know if the DJ would like to, or any other person would like to answer this question. How can Nigerians get a better commitment to improve on our current capacity? Commitment, I mean bringing every MBAs together, NDAs together, in order for us to achieve so much. Because you find out that in the report, some ministries or agencies were actually lacking behind, while NCDC was actually in the forefront. So we'd like to know how we enhance ourselves in order to do well next time. And I wish the WHO representative for Nigeria is here, because he made some statement saying, just a clarification, he described Nigeria as a such complex country with contradictions. You know, in order for us not to misinform the public, we would like him to explain this in a better terms. Thank you very much.
Okay. Thank you, Rachel, for your questions. So we had the JE in 2017, and this revealed really um, less than desired state of affairs. Included in the report then was the finding of, really poor One Health collaboration, among other things. Some work was done and put into that space, including passing the NCDC Act, finally legally handing over IHR coordinating responsibilities to a particular agency. And in alignment with that, some investments, both domestic and otherwise, were brought in to strengthen One Health collaboration and strengthen surveillance and other things. We are now seeing the results of all of the things that were done in the aftermath of the and there is progress. Certainly the growth of a tree does not happen overnight. One moment there is nothing to be seen, but there's stuff going on underground, and then the tiny shoot emerges. But it's often takes a lot of time before you get to this huge tree with many branches that provides shade. Okay, so we are in a period of growth. We went from very little going on to having what is considered relatively good One Health coordination at national level. It's not where it's supposed to be, but it's happening. Okay, and we recognize, even before the JEA, that needs to be strengthened. And more importantly, or maybe equally importantly, we need to replicate anything that is happening at national level, at subnational level. So the summary answer to that question is, again, we will take the recommendations and priority actions from this report and work on them. We have been reassured by our principals that they are fully committed to the process. And we know that as we all go to our respective ministries to brief our principals in the coming weeks, we will come up with a plan to address coordination, to address other areas that have been identified in the report. And the countdown is on to ensure that we can achieve and demonstrate progress by the time we call for a midterm review in a 2-year period. So hopefully you will work with us to hold all parties accountable and ask the necessary questions to also put us on our toes. Thank you. So I'm not qualified to speak for the WR, but I think it's important that you don't misunderstand him. As my understanding of what he said was that, you have a mixed picture. You have a picture where we have very well set up, for example, immunization services, okay? Access, cold storage, infrastructure, plans, recommendations, guidelines are there, but we also, in contradiction, have less than desired vaccination coverage. And I think you all know it. I've had to answer questions posed by many of you regarding diphtheria, okay? We continue to see outbreaks of measles, of yellow fever, and other vaccine-preventable diseases. But we know that if you want to get a vaccine in most parts of Nigeria, if you are interested, you can actually go somewhere and get a vaccine. But we have some issues around security, hard-to-reach areas, mobile populations. And again, it's just to remember that a lot of the issues we are seeing in terms of vaccination coverage now are the consequence of really long-standing gaps. Okay, the more recent effort to address and improve immunization coverage does not close the gaps that you established years before. And I'll give you an example. So for diphtheria, most of the cases that are affected are older than 2. They are 2 to 14 years old. Within the 2 to 14-year bracket, the 5 to 9s and the 10 to 14s are the most affected. Now, a 14-year-old now who catches diphtheria has caught diphtheria because how many years ago? 14 years ago, as an infant, they missed the opportunity to be vaccinated. So all of this more recent endeavor, sadly, will not close gaps of 10 to 14 years ago. What we are now being reminded of is that we need to act innovatively and put in place other measures to shore up routine immunization, ensure recovery of gaps that were opened by the COVID pandemic, but then also catch up with historical gaps that exist. And this is what all of the relevant partners and MDAs are working to try and correct. Certainly, we now will need millions of extra doses of vaccines to close historical gaps. We will need logistics and finances and all the other things that you require. For example, if you were to start mass campaigns nationwide, these are not trivial endeavors. They need careful planning, careful resource mobilization, and significant logistical details need to be worked out. I think the last question was for Hen. Yes.
Thank you, Director General. The question directed to me was about takeaway messages. I have two for Nigeria. The first is coordinate more what you are doing. A lot is done, but health depends not only on your body, it is also your environment. When you are polluting your environment, you are making the people sick. It is also dependent on the animals. More than 60% of the infectious diseases of human beings originate from animals. So when the animals get sick from the wildlife, then the human beings get sick as well, and a new pandemic can start. But even before the new pandemic, your own Nigerian people will get sick from this. We call this One Health. We cannot only leave health to the doctors. We need it also to the veterinarians and to the environmental professionals. So that is my first takeaway message. My second takeaway message is implementation at local level. A lot is done here in Abuja at the federal level. A lot of plans are made. A lot of things are tried to be put in place. But before 1 million naira is in the local community, how much is left of this? So we need transparency of the money stream. We need, instead of talking, we need doing. So that is my takeaway message for Nigeria.
Okay. So,
well, just to say, again, the message on coordination has been received. We now need sort of a geometric improvement in coordination, and colleagues here representing all from the animal and environment sector are here just to show that, yes, we have all received the message and we will all go back to our respective ministries and principals to make plans to improve this, and of course, improve this at the subnational level. Any other questions?
yeah, we can take one, two more. Are there other? Okay, so we have the next question. Please introduce yourself. You have the mic.
All right. My name is Frank Ajufo. I report for Vision FM Abuja. My question is on lessons learned from COVID-19. I want to ask, how have these lessons impacted the outcome of the 2023 JEE? And moving forward, how do you intend to expand on these lessons learned for better results, to have better results I mean, we were told that the percentage increment is not sustainable, and there is a need for us to improve upon it. And you rightly said that you don't want to find yourself working towards JEE at times of when you want to retire and all of that. So I would like to ask, what are you going to put in place to see that we move at the speed? You recommended speed as one of the factors we need to apply. How are we going to move at that speed to ensure that we get better results in the next JEE? I think there was the concern about how we handle our livestock and our animals and how it affects our lives as humans. What would you recommend, sir, in key terms that we should put in place to improve the handling of our livestock such that we could in future control zoonotic diseases, which has clearly shown that a huge percentage of diseases that affects humans are zoonotic. So what key steps should Nigeria adopt to improve on our relationship with the livestock? Thank you, sir.
Okay, thank you. So in the context of the COVID-19 pandemic and lessons, I think it's not just lessons. I think we've benefited from the investments in the pandemic response. I think that our gains in the areas of detect and especially response, even if it's still quite low, were very much due to a lot of the investments and increased attention that came to these domains in the context of the pandemic. And similarly, even to other IHR hazards, like the work and the gains that we are seeing in the point of entry, technical area, and others. COVID showed us that clearly we need to prioritize subnational actions. This is why even before the JEE and in recognition of this, at the NCDC, we created an entirely new department of subnational support because we already recognized that we would only be as strong as our weakest link. And this is a theme that continues to emerge from every conversation. So I think it's very clear for us and for MDAs and for, as we will convey to the highest level of governments and also in engagement with state government authorities, that we need subnational, concerted subnational action and investments. And we will, from a national perspective, support this. The lesson from COVID highlighted the need for better coordination and the recognition that pandemics, just like many other public health events, are not just a matter for health. They require an all of government and all of population response, including private sector, CSO, media, and all of that. This is why we have done and will continue to do a lot of work, more of work on risk communication, community engagement, on coordination, on subnational support, and even public health laboratory networks. And public health laboratory networks, not just from a human health perspective, because we are not only assessed for what is achieved in human health. We need to have effective public health laboratory networks in the animal sector and even the environmental sector. And we will work with all of the relevant MDAs, institute agencies, to bring about some more progress in that area. I think, the bottom line is at the end of 2 weeks, when we receive the detailed JE report, which of course will be widely shared, all of us sitting across board, and indeed the entire world will know what the recommended priority actions are from this JEE, and therefore you have a tool to hold us accountable. I think from our perspective, what we hope we can put in place from for a coordination perspective is we are going to have to make sure we have a proper M&E framework that is fully understood by all PAMSECs and ministers in terms of what their MDAs are supposed to be contributing to the health security agenda, and that we can monitor closely and give scorecards so that everybody is conscious of what needs to be done. You know, the One Health mantra, so when I went to school and learned public health, I wasn't taught about One Health. They are covered separately in the curriculum. And then this philosophy was introduced and gained ground over the last decade or so. You know, even if people were doing excellent work in the individual areas. But now the recognition that you needed to synergy, that the only way you can preserve human health or assure human health is to take care of the environment and take care of the animal sector, is a relatively new philosophy, even in our part of the world. Okay? So we have to also work as a lesson from COVID to overcome, well, not, first of all, to fully socialize and make sure that this philosophy is internalized at every level. We still have the occasional reflex to do things the way we used to do them before, that, okay, I'm just going to look after health. The human beings are the most important, which is why we had very interesting, I don't know, laughter comments when we were reminded that we needed to pay attention to the welfare of animals. And I'm sure people were like, which animals? We are talking about human welfare, you're talking about animal welfare. But you can see that that actually reflects, still reflects the traditional belief that does not necessarily recognize that the well-being of an animal is tied to the well-being of human beings. You know, but interestingly, some people who look after animals, like a lot of our nomadic herdsmen and nomadic populations, even in Africa, like the Maasais and co, they already know this. In fact, we laugh at them sometimes that they look after their animals better than they look after themselves, isn't it? Okay, but they recognize traditionally that they needed to look after, the traditional practices looked after the environment and looked after the animals. Of course, there were room for improvement in terms of vaccination and things like that, and not necessarily having to roam around. But we need now to internalize this, find innovative ways to communicate it to achieve saturation and full understanding, and to make sure that at every opportunity, whether it's in government or anywhere, everybody is thinking One Health. When you make a plan in health, you know, you pick up the phone and say, can I speak to the chief veterinary officer of Nigeria, or can I call the director ED of the National Veterinary Institute? Can we look at what we can do together in this space so that it's not just an anthrax plan for human beings, but it's an anthrax plan for the country that takes into account what everybody does. It's a rabies plan for everybody, you know. And we are committed to doing that even better. We have started, but we will do it better, and we will also make sure that the idea permeates down to the subnational level as well. I think, Hank, you have...
Yes, thank you, Director General. It was asked to me more specifically on the animal health sector, what they could do. And then, as a WHO officer, this is more the field of FAO, but I'm a veterinarian. So I can tell you that and this is for One Health, for human beings, for the environment, and for animals the same. We follow, prevent, detect, and respond. And let me give a practical example. There is a global threat of avian influenza in birds, in chickens. And this can mutate into the next pandemic for human beings. To prevent this, it is necessary to have a good surveillance system in animals, also in wildlife. So improve the surveillance system in wildlife and in animals, in this case birds, but I would say in livestock in Nigeria. That is prevent. Then detect. If you if you detect this through this, then you need to find what to do. One of the main issues to do is to improve hygiene from farm to fork. There is a lot improvement possible. And then respond. You need to have ready plans for adequate response as soon as you see this. And a disease you can best fight at the source. As a fire, you can best fight it as soon as it breaks out. The same for a disease. So it is quite simple. Prevent, detect, and respond.
Thank you so very much to the team. Then we may not be able to take further questions. Apologies, because this venue also needs to be used for an event. Let me recognize and appreciate contribution from the panelists for the conversation so far. We are now at the end of this press briefing. I may yield the floor now to the Executive Director, National Veterinary Research Institute, for the vote of thanks. ED, please.
Thank you very much. I'd like to start by thanking the team on this side, the group that has worked in the last 5 days to come up with this report, both the international and the local teams working to ensure that Nigeria is at a vantage position where we are able to maintain our health. I also would like to thank profusely the DG of NCDC for all the hard work that has gone into this work. And as he said, One Health, the NCDC is the anchor because it is responsible for coordination and is leading this work. But they are not the only ones that are working behind the scenes. All the MDAs are all hands on deck. But at this occasion, I think we need to thank the members of the press. One of the major important pillars of this work is risk communication. And that means all of the hard work that has gone on. If the media is not here to be able to communicate it to the wider society and the community, then a lot of the work will go unrecognized, unchallenged, and unappreciated. And in fact, that bridge will not be, that gap will not be bridged. So we'd like to thank you on behalf of all of us, members of the press, even as we know that you will communicate very well this activity that has taken place and what will take place in the future, and to help with disseminating this information to the greater population of Nigeria and to understand what we all need to do to safeguard and secure our health. Thank you very much for coming.
Very much. Thank you very much, everyone. And that brings us to the end of this press briefing. Thank you, gentlemen of the press.